Purti, if you could please record it here. Thank you. So good morning, everyone, and I welcome you all to the May edition of Beyond Research webinar series. We started off with this series in January, and it had a mandate of bringing together the researchers and the enablers of their research. It is aimed to understand the wide arena of opportunities available globally and how these opportunities are implemented on ground. Of course, in this journey are the partners who bring together countries and communities, funders, administrators, and the healthcare providers. There are partners who bridge the gap from bench to bedside, from planning to performance. They allow us to take up competitive research problems, increase the research output, streamline its relevance, and make it accessible to public at large. In this webinar series, we are inviting representatives from such organizations who enable and provide opportunity to do value-added research. Today, we have with us Dr. Jorge Saavedra and Dr. V. Prasad from AIDS Health Foundation. Briefly, I'll introduce the speakers here first. Dr. Saavedra is the Executive Director of AHF Global Public Health Institute at University of Miami and Global Public Health Ambassador for AIDS Health Foundation, as well as President of AHF Mexico. He is a medical doctor with 2 master's degrees from Harvard University, one in public health and the other one in health policy and management, both from the Harvard University. Among the many roles which Dr. Saavedra has donned are being former Global Fund board member representing Latin America and the Caribbean, former member of GF Strategy Committee, and member of Developing Country NGO. He has several publications mainly related to AIDS economics, and the latest ones are on the global response to public health convention in the 21st century. I welcome you, Dr. Saavedra. And our second speaker is Dr. V. Prasad, who is the Country Program Directors of AIDS Healthcare Foundation in India. Thank you both for joining us and giving us your time. I would also like to invite all the other attendees. Please do type in your questions, which we will discuss at the end of the talk. Thank you. And without taking any further time, I welcome you, Dr. Saavedra, to present.
Well, thank you very much, Dr. Advocacy, for this invitation and this opportunity to talk with the participants here from this side of the ocean at 1:30 a.m. in the morning here. But I'm glad that you are here, and I'm glad that you invited me. So I'm going to start with by sharing my screen with a presentation that we prepare for you, and I will start with it. So let me start sharing it. Okay. Can you see it now?
Yes, we can see. Thank you.
Okay, let me, because my screen is getting like frozen. Okay, yeah, now I have it. Okay, so AIDS Healthcare Foundation, I'm going to start with kind of a brief introduction of what AIDS Healthcare Foundation is. It's a global nonprofit organization, but it started in 1987 as part of the response to the HIV epidemic that later became a pandemic. But during the time when there was little providers that wanted to deal with HIV patients, by then they were always diagnosing AIDS patients. And it started in Los Angeles, in California, in the US, as an AIDS Hospice Foundation. And it was mainly to provide this palliative care that at the end of the 80s and the beginning of the 90s, that was the only kind of care that was available. And then after the highly active HIV treatment, that was kind of discovered by the end of the 1990s, AIDS Hospice Foundation, it transformed itself into AIDS Healthcare Foundation, and it started providing treatment and medical care to patients in the Los Angeles and Southern California area. Later started growing, and by year 2000, AIDS Healthcare Foundation was the first nonprofit organization to start providing treatment in Africa, especially in South Africa, in a time when the government of South Africa was not even able to recognize that HIV was a problem for South Africa. So AHF started doing it, and then it evolved to other countries, especially to Uganda then in Africa, later to Mexico, and also to India. And I will leave the part of India to Dr. Prasad. But the organization aim is to provide cutting-edge medicine and advocacy, regardless ability to pay. Our services globally are provided in 45 different countries in Latin America, the Caribbean, Africa, Asia, Eastern Europe. So we are all over the world, including, of course, the United States, where it started. Right now, we are supporting around 1.6 million people with HIV, and we are currently the largest providers of HIV/AIDS medical care in the world. It was mainly an HIV organization, but in year 2014 and 2015, when the Ebola outbreak started in Western Africa, we lost a doctor there in Sierra Leone, and it was the only infectologist, actually the only virologist in Sierra Leone, and he was our doctor, and we lost him to Ebola. And that was kind of the main incentive for us to start addressing other public health issues, and not just HIV, AIDS, and also STIs. So we started caring, but not just about caring, but also trying to find a solution to the global health architecture of what was wrong with it, why some global organizations were not responding properly during those kinds of emergency situations. And then we started working on that area for other diseases as well. And it was until 2017, 2018 that we structured a partnership with the University of Miami in order to create a AHF Global Public Health Institute at the University of Miami, in order to engage in global public health policy analysis and research to generate objective evidence that can inform improvements in public health policy at the global, regional, national, and local levels, but particularly for infectious diseases. That's the scope of our work mainly, is about infectious diseases. We started last year supporting some genomic sequencing projects. And I'm going to share with you a very short video on how genomic sequencing and why it is important, genomic sequencing, especially during the current pandemic, but later for any other kinds of pandemics. So I'm going to share this video before continuing with other parts of my presentation. And I hope you can hear it. We did kind of rehearsal and it worked well. So I hope it works well right now.
New epidemics and pandemics are an ever-increasing threat to our interconnected world.
Can you hear?
Yes, we can hear.
Okay, so I will continue then.
New epidemics and pandemics are an ever-increasing threat to our interconnected world. But scientists can recognize emerging viruses and help prevent the spread of diseases by understanding the mutation patterns. Armed with this knowledge, scientists can develop new drugs, vaccines, and diagnostic tests. This viral surveillance is performed through genomic sequencing, a process of analyzing genetic material in laboratories that allows scientists to understand when and how a virus has mutated as it replicates in a population. Genomic sequencing makes it possible to find new variants, know the current epidemiological picture in countries, regions, and globally, and predict future scenarios. But access to this vital technology is very uneven within and between countries. Because genomic sequencing is essential to ending the pandemic, AHF is supporting 15 sequencing projects in 14 countries in a partnership with GSAT, a global science initiative that facilitates the open sharing of genomic data. Thanks to GSAT and the many data submitters worldwide, life-saving countermeasures to COVID-19 were delivered at unprecedented speed, including the first vaccines and diagnostic tests to combat SARS-CoV-2, the virus that causes COVID-19. With access to this global database, scientists, stakeholders, and decision makers can stay on top of virus mutations and take appropriate action to help prevent the spread of the virus and any new variants.
So the idea was just to inform what is genomic sequencing in a very kind of simple language to be understood by everyone. So given the increasing presence of these new strains and the urgent needs to monitor real time the presence of the new ones, AHF has launched this grant in 2021 in order to ramp up research and provide a unique opportunity to generate high quality evidence on the new SARS-CoV-2 variants that are currently expanding through the world. We seek to expand the current genomic sequencing capacity in national, regional territories, fostering global evidence in the fight against COVID-19 pandemic, and also to decrease the time to deposition of the sequenced samples in the global initiative on sharing all influenza data. That's GSAT platform. We signed an MOU with them to collaborate and promote genomic sequencing globally. So we promote and advocate to emphasize the importance of genomic sequencing as a tool to fight these and future pandemics. And I'm sure all of you have heard of the different variants, and currently not just Omicron, but Omicron sublineages. And that means a different kind, almost a variant, but they are not exactly variant because it's still Omicron, the dominant strain. Last year,
Dr. Saavedra, sorry to interrupt you. Could you please put the PPT in slideshow mode? It might be more convenient for the attendees.
Okay. Yes, sure. Let's see if it moves here. Yeah. Can you see it now?
No, it's still. Yep. Thank you.
Yep. Okay. Yes, you're welcome. So we started doing this. It's not just about to increase, because we don't think at AHF have enough resources to fund all the needs that are globally there in terms of genomic sequencing. But we understand the importance of this. So that's why we started providing these kind of relatively small grants. But many of the countries and many of the institutes that have received these grants have done marvelous things with this funding in terms of either expanding genomic sequencing or incorporating new equipment, or sometimes they just needed reagents to continue doing genomic sequencing. So we were kind of shocked to know that many governments, they still don't understand the importance of genomic sequencing. Still some countries are not doing genomic sequencing, and some others are struggling to do genomic sequencing besides or despite the evidence that this technology needs to be available globally and all countries need to be doing it. So that's why we started doing it with these 15 countries and 15 projects in 14 different countries. I'm going to share some of the results that they are sharing with us. Like these are the countries, these are where they are located. So we are sponsoring one in the USA at the University of Miami. In Mexico, we have 2 projects running, one in Jamaica in the Caribbean, another one in Trinidad and Tobago. Another one in Peru, in Brazil, in the northern part of Brazil, in the Amazons, another one in Argentina, Nigeria, Uganda, Kenya, Pakistan, Thailand, and of course, India. So part of the results, these are kind of the summary of the latest results that we are identifying, not that we are identifying, we are receiving the reports from different projects. Like, for example, the latest reports that we received from India is that, of course, Omicron is the dominant variant, but 99% in India right now is the sublineage of BA.2, and the Omicron BA.1 is just 1%. In Mexico is BA1, the dominant sublineage is 100%. But we have another project that is targeting some other parts of Mexico, and we have different kinds of identifications, like they have identified BI.2, BI.1, and BI.5 as well. So Pakistan as well, you can see the results here from Peru, Argentina, the USA, which have a larger percentage that they still don't know what kind of sublineage it is, but they have certainty that it's still Omicron there. So right now, all over the world, the below table is about the numbers. So as you can see, are really small or relatively small numbers. But anyway, what we can see is right now is about Omicron only, is no longer Delta the concern. Although in some parts, still Delta appearing in some cases, but mainly with samples that were obtained in previous months. So that was the case of Brazil. Still, Omicron is increasing in the northern part of Brazil. It's not that Brazil is not affected predominantly by Omicron, but this is a remote region in Brazil, which is located in the Amazons, where Delta was still the predominant strain. So we have these results either from India, from the different institutes in Mexico that we have, Thailand here. As you know, that has been the history. It was mainly Delta last year, and now is mainly or predominantly Omicron, what we are looking at. So this is another institute in Mexico where they are targeting different areas of Mexico. Mexico is a large country, so they also need to target some other areas, because sometimes rural areas tend to get the variants very late. In the urban settings are the ones that are usually affected rapidly by the spread of new variants or new sublineages in this case. So we have also the results for Pakistan, Peru. This one is in Nigeria. In the case of Nigeria, it's a little bit different kind of project, because what they are doing is testing at the airport. It's not about testing people outside, but they have concentrated in the airport passengers. But again, it's mainly Omicron right now. In the case of Argentina, was a very interesting case because they were doing genomic sequencing for agricultural purposes. And when they received the grant from AHF, they moved it from agriculture to humans. And that was great for us. That was a great kind of achievement that they did with our funds. So we were really happy to know that they were able to move from agriculture to humans in terms of the technology, because the technology of genomic sequencing has been developing, of course, for different purposes. It's not just for COVID-19. Now is globally known because of COVID-19, but it has been existing for several years now. But it works well for many other viruses, including viruses and germs that come from non-humans, and that's why they were using it from agricultural purposes, for agricultural purposes. Also, the USA, they are now mainly with Omicron, but the different sublineages that they have on Omicron. The West Indies and Jamaica, they are also reporting mainly Omicron. In the case of Trinidad, they were able to succeed with this grant to incorporate many other countries. You know, the Caribbean is a region probably not so far away from India, but it's a region with at least 15 different countries, but they are really small islands, and every island is a country. So not all of them, they were able to access genomic sequencing. But again, with this funding that we provided to Trinidad, to the University of West Indies, they were able to incorporate some other countries to the genomic sequencing processes. We also have a different kind of project in Uganda. They are reporting in a different way. What they are trying to do is research, a study to identify variants or COVID-19 variants and mutations in HIV positive people. So there has been many kind of stories, some kinds of preliminary reports that probably some people in Africa, especially in Africa, might be developing some different variants because of the HIV prevalence there, but there is nothing conclusive. But this is kind of preliminary stages of this project in Uganda. In the case of Kenya, the Kenya Medical Research Institute, what they are doing is genomic sequencing, but not in people, but in populations, because what they are doing is testing wastewaters. So that's another way to identify the presence of COVID-19 or the SARS-CoV-2, the virus that produces COVID-19. So in these cases, still under development, this situation, because there has been some challenges, because, you know, wastewater sometimes they get diluted during the rainy season, and sometimes it's difficult to get the right samples in order to produce the proper genomic sequencing. So it's quite a challenge right now. It's under development. The only genomic sequencing project that was canceled, and it was canceled not because of lack of capacity of the researchers, but because of the situation Ukraine is facing. So they told us that they were not able to deliver right now. In fact, one of the researchers dealing with this project died just like 3 or 4 weeks ago. And well, that's a very sad situation that Ukraine is facing. So that's the only project that we needed to cancel as for request by the researchers. Not that we wanted to cancel, but they cannot concentrate on doing this during a war situation. GSIT is a partnership that we established recently. And what we want to do, this platform is an online platform that is an independent one, where all researchers of the world dealing with genomic sequencing, they can upload their information and upload it preferably in a short time. So this is the way that the global researchers and the and the entire population know whenever there is a new variant, when there is a new mutation of the variant, when there is probably a recombination of viruses or variants. So this platform is doing a great work, and now we are also supporting them in order to promote not just more genomic sequencing, but also the speed on when the sample is collected, when the results are shared with the rest of the world. Probably you don't know it, but in many cases, the identification of the different variants happens like several weeks ago. And when the world knows that new variants exist, is several weeks later or several months later. So the last identification of Omicron, it was reported from South Africa, but that does not necessarily mean that it was created or it appeared first in South Africa. It was because in South Africa, they have a very well-established genomic sequencing system in order to collect samples from everywhere. It's not that they are doing a lot, they are doing sampling very good in all the Southern Africa region. And that's why they were able to kind of discover Omicron first and report it to the entire world. Unfortunately, as you know, they face consequences because as soon as they reported a new variant, the rich countries started to ban flights to South Africa. But it was kind of too late by then. I mean, the thing is that they discovered it first, not necessarily means that it was only there, because later on it was discovered that, yes, the Omicron was circulating in Europe as well, and a few days later in the United States as well. So this means that the speed of timing and from collecting the sample to doing the test and doing the genomic sequencing is crucial to be in shorter time. And that's what we are doing to promote more genomic sequencing and more timely genomic sequencing. We have been also advocating, sending letters, asking the researchers to sign on these letters in order to promote the idea that genomic sequencing is needed. And it's needed not just to stop the current pandemic, but it's needed to prevent and prepare and respond to the future ones. And that's why the importance of genomic sequencing, and that's why we have been committed to start supporting these projects. Genomic sequencing can be also used for HIV, for many other diseases as well. Now we are receiving a project in that direction, but it is not us. We are not large funders of these projects. We are just promoters. We are mainly investing to advocate and to demonstrate that this is something needed in order to identify variants, subvariants, and new threats. So I just want to share part of the team working at the AHF Global Public Health Institute at the University of Miami. Some of them are based in Miami, some of them are based different places, especially in Mexico in the case of Ariel Garcia and Juan Manuel. But not all of them are based in Miami, but we are based in Miami as an institute at the University of Miami. So right now I'm going to leave this part because I also want Dr. Prasad to talk about AHF in India because we have a long history there, and Dr. Prasad is leading the efforts of AHF in India, so he can give you a panorama of what AHF is doing in India. We are not going to talk right now in India about genomic sequencing, but about the other activities that AIDS Healthcare Foundation is doing in India. And I think at the end, we will have time for questions and comments or any other kind of points of view that you would like to share with us, or that you like to expand? That for us to expand. Okay.
Sorry, actually, we got disconnected because there was some internet issue at our end. I think it's affected the other participants too. But anyways, we can go ahead. So Dr. Saavedra, we'll take all the questions at the end. Maybe Dr. Prasad can go ahead with his presentation.
Thank you so much. And can I share screen, please?
Yes, please.
All right. Are you able to see the presentation?
Yes.
All right. Thank you so much. Yeah. Thank you so much, Dr. Saavedra, for that outline of the genomic sequencing activity and the support globally. And Dr. Aradhita and the team here, thank you so much for this opportunity. So HIV in India is registered as a trust, which is called the India Cares. So we are known as India Cares in India. Just some basic information about the country with the 1.3 billion people and HIV prevalence of 0.22. We are active from the year 2007. Which was the very first time that the People's Clinic, or what we call as a Center of Excellence, was dedicated. This is the HIV prevalence. Globally, India stands second after South Africa with 2.3 million cases or HIV positive people living with HIV positivity in the age group of 15 to 49, and that amounts to 0.22% of the population. I don't know how many of us are familiar with this, 1990, the principles of 1990, where 90% of the people living with HIV have to be identified, 90% of them to be put on treatment, and 90% to be achieving viral load suppressions. And now it has gone to further beyond this. It has gone to 95, 95, 95, where we are targeting the last, but not the least, group of people who have to be yet to be identified and brought into care. So this is our scorecard, and this is where we stand. So we are 90% with the, 78% with the status, 83% with people on treatment, and PLHIV virally suppressed is 85, and globally you can see the the target, way beyond what India has done. This is our clinic and our management admin office in Delhi. We are housed at Lajpat Nagar 2 near the metro, and we are known as the India Cares, as I told you before. So where do we work? We work in all these states, a presence of around 11 states right now. We are expanding. Also, the impetus for us to work is that the range of the prevalence is ranging from 2.3% in Mizoram to Jammu, Kashmir, and Ladakh, which has got 0.06%. So we're looking at the high, prevalent states in India, where like Mizoram, Nagaland, Manipur, Andhra, Meghalaya, Telangana, Karnataka, Delhi, Maharashtra. So what we're trying to do is to supplement and complement the National AIDS Control Organization's work through our support. What do? The three pillars are the prevention, testing, and treatment, and you can see that represented by the pictures. But let's go into that. Prevention, of course, we are the best part of the cheapest part of preventing an HIV infection or STIs is condoms, and we are the first ones to come out with the free condom store, online free condom store. This takes care of your condom requirement and access to condoms through the free condom store. One has to just send in a mail or call the telephone number, the toll-free number, and then we take care of sending the condoms at your preferred address. Many people might not want it to be sent to their homes, but then probably if you have any space that is safe and comfortable for you, because there is a lot of stigma still around, buying condoms. For example, I always use a simile saying that, if a lady walks into a pharmacy store or a medical store to buy condoms, I think it's going to be really difficult for the lady. So we're still somewhere there. So we do definitely support and complement the access of free condoms. Post-exposure prophylaxis is nothing but when a person is exposed to HIV infection, within the first 72 hours, we give them the ART medication, which is required to prevent the HIV infection from getting into the person or cutting the transmission. And the medicines has to be taken for 28 days. And that's been a pillar of support for preventing, especially those people who are at risk, the MAPs, as we call them, most at-risk population, or the healthcare, personnel across the country. Prevention, of course, continues with our International Condom Day, which we instituted on the 13th of February every year. So what we do is we pull out this 40 feet condoms, inflatable condoms in major cities like this one on the center that you're seeing is right there at the CP circle, where a lot of people assemble together, and then we take their signatures as endorsing condom use in this country. So there's a lot of free condom distribution on the site at that time, and then we continue with engaging with communities, NGOs, policymakers, classrooms, colleges, youth, etc. So a lot of prevention work happening there. Testing, to supplement the Know Your Status program, we do have institutional testing. That is where we have two clinics, one in Mumbai and one in Delhi. This is beyond and above the government centers that are working in India, but then we get an average of around 50 to 100 clients in a month coming and do testing and taking up the services. Community-based testing, of course, we do have the rapid testing program, whereby the team, under the care of a doctor or counselors, they go into the community and mobilize people to do testing. Moonlight Testing is an acronym. Moonlight is mainstreaming out of network, laymen, intersex, or IDUs, gays, visitors, and transgenders. And as it explains itself, this is again done during the wee hours of the night. We start the testing by around 6:30, 7 in the evening, and then continue that for till around 10, 11, so that these people who are out of the network, because all the government services, most of them are closed by the evening, and those are day clinics. But we have supporting a night clinic to support the Moonlight HIV testing and the new identification that has been done there. Assisted self-screening and assessment program is a new concept that we have brought in. This helps to understand the positivity among LGBT community, especially the gay MTH, as we call them, as the MSM, transgender, and the gay community, or the Hijra community, and it looks at giving testing at their preferred site with an assistance, with an impulse buddy. I mean, there's a peer-led self-screening or assisted self-screening test programs. If you look at the cumulative numbers, we have got around 2.3 million tests, and positive identification comes to around 20,000. And these are regularly being reported to the State AIDS Control Society or NACO. And you can see the test kit sample is there on the right side, and how we do the testing from the kiosk. Again, you can see on the first photograph is where the Moonlight testing is happening in the night. This is in Delhi, in the ISBT area, the interstate bus terminus, where a lot of clients are there. And last night also we did the HIV testing, and the results are like after 25 tests, 3 HIV positives were identified and linked on the same night. So on the second photograph, you can find that there is visitors from NACO, from other ministries who are coming and getting interested in this kind of a model, and that led to 2 or 3 states taking up this initiative, and that's now known as Moonlight testing in the state of, especially in the state of Telangana, Karnataka, and Mizoram. Of course, our previous health minister, he himself visited the testing and saw that. You can see honorable past previous minister, Dr. JP Nadda there. And during COVID, we didn't stop the HIV testing. We continued with our PP kits and protecting our staff, but then we still continued because that was a great challenge, a big challenge across the globe, rendering this testing services. Treatment, of course, we go by the units and the WHO call of undetectable is equal to U, which is undetectable is equal to untransmittable. Based on that, we have these clinics. As I told you, 2 clinics there. We have a full-fledged clinic where there is all services are free, first of all, no registrations. And starting from HIV testing, counseling, ART services, and also the OI care or opportunistic infections that can come when you're HIV positive. All these are taken care of, and given free medication. During the COVID, we did the MMDs or the multi-month dispensation so that people need not come regularly to the clinic. They can take a 6-month or a 4-month or a 3-month course and then save their time, efforts, and money. And because of the lockdowns, they were not able to access. So we went in for multi-month dispensation. These are the services that I was trying to say: HIV counseling services, testing, CD4, viral load testing, STIs, routine blood tests like CBC, RFT, LFT, etc. Tuberculosis, because TB is most often found, OI, opportunistic infection, along with HIV. Post-exposure prophylaxis, I was talking about that. ART is antiretroviral therapy, ATT is anti-tuberculosis treatment medication. Counseling services, specific guidance for families who are planning for their pregnancies, education and of sex practices. Now we have a psychiatrist and an ART, physician with us, so we are engaging him with treatment of psychiatric illnesses, education, substance abuse education, de-addiction services, etc. So finding employment. So we go beyond the treatment services to find suitable placements for people, so that their socioeconomic support is also there. Impulse group. So this is an affinity group of AHF, is an international group. We are there in 25 cities across the globe. These definitely, these are definite programs catering to the LGBTQIA communities, or the sexual minority communities. And what do? We do activities to engage them, give them the safe platforms. We do campaigns on HIV, STI, syphilis. We educate them with videos, workshops, and thereby what we are doing is trying to reduce the stigma on HIV, because this is double stigma. Always there is HIV stigma, but also then being a part of the sexual minorities, they face a lot of stigma from the general community. And during COVID, we found that there's a lot of mental health issues that are coming up because of confined spaces. One has to be at home, not a conducive environment, no family support. So mental health is on the rise, and then all these tensions about the new pandemic that is there, takes a toll on the community. Substance abuse is very rampant among the LGBTQI community, so we support them with that, and we are striving for social equity. Recently we have this transgender bill which has been passed in the parliament. We did almost around 190 questions in the parliament about through the MPs who are closely knit to us, through the Forum of Parliamentarians on HIV/AIDS, and thereby trying to bring in social equity and the like. Of course, Impulse, these are the events that we do. We do have fun, but then at the end of all the parties or the sessions, we do HIV testing and detect a lot of young youth, populations from the LGBTQI community who are having this infection but never knew their status. So that's the way that we help them around, and then we link them up to the clinics. So we have Impulse New Delhi, Impulse in Mumbai, and also now we are looking at a new chapter in Bangalore. So what we're trying to do is saturate this all the low-hanging fruits have already been taken care of, but these are actually the people which we term as the MRGs, the missing risk groups, because these are educated young people, but never trying to access the services through the government centers. But then through an approach of Impulse, we are able to collectivize them, sensitize them, educate them, and also put them onto treatment once we identify them. So that's about Impulse. Girls Act is again an affinity group to protect and empower girls across the globe. So you can see where all we are working. And this is about putting the focus on menstrual hygiene, iron deficiency anemias, taking if there are children, especially girls, born out of sex work or PLHIVs, people living with HIV who are semi-orphans or orphans, affected and infected. We take care of them and provide a platform for them to get empowered through education, through scholarships, through exposures, etc. Advocacy is another pillar. Of course, we work with all the ministers. You can see a couple of MPs who are familiar with the Member of Parliament in India. We have the previous ex-health minister, Dr. J.P. Nadda, Dr. Harshvardhan, and we did open up the People's Clinic in Delhi with a colorful array of MPs. We had 7 MPs coming in and supporting us here. Also, Sri Jay Panda, Honorable MP, was very much with us, working hand in glove in getting the transgender bill in place. Again, Honorable Minister from Telangana, the Health Minister, inaugurated the Moonlight Testing event or the Moonlight Testing initiative in the state of Telangana. Those are the photographs that you are seeing right now. Dr. Sri Mansukh Mandavia, the current Honorable Health Minister, is very much aware of our operations and support us. We are trying to partner with the Health and Family Welfare Ministry to get digital space for ART replenishment, so that people don't have to go to the ART centers, but then they can replenish it at any of the medical stores or the designated medical stores in the state capitals. That's what we are currently working in. We're so happy that the current minister is taking a lot of interest in supporting our programs. Vaccinate Our World, Dr. Saavedra's pet project probably. We did come out with a global campaign on Vaccinate Our World at the very first initial days of the COVID infection, the COVID pandemic, because we thought this is something that has to be going to the world when there were a lot of skepticism among people and communities who were opposing vaccinating or getting COVID shots. So we did have a campaign. You can see the Minister of Health and Family Welfare, the current minister there. We have several other ministers. We have NGO groups. We have MPs who are supporting WOW, and we took it forward, and it's now all over the world. Advocacy, again, we do a lot of advocacy through the media, so we call it as a media advocacy. So these kind of stories which are appearing in the media are converted towards, we do models and then convert that to programs and then help states to pick up, the missing links in HIV. So we innovate, the middle picture that you see is a kiosk of condoms, free condoms, which are placed in the most famous bakery in the city of Aizawl in Mizoram. So, a very different approach towards, sensitizing the community about condoms. Whenever they go there, they can pick up the condoms. On the right, what you see is, again, Love Brigade, bike taxis and the taxis that are applying through the streets in Mizoram. They are all given a jacket and red jackets and red seat covers where condoms are kept, and then you don't have to actually get stigmatized or even identify yourself while you pick up a condom. The bike taxis, they can just pull it out from the back of the jacket and from the seat covers when they are using the taxi. So this become a big, huge hit because Mizoram is a state where it's a Christian, driven state, and the church initially were very much apprehensive about having to talk about condoms. But then this Love Brigade activity actually destigmatized, and then now the church is coming up and saying, okay, you do your work and we do our work, but then do it in such a way that that it doesn't stigmatize people. So these are some of the models that we do. We definitely take media advocacy and then make it part of our overall advocacy. So I think I'll stop there. Thank you for the opportunity. We still continue to do our work. This is our team, Mumbai and Delhi team together. So I thank all of you for your patient listening. Thank you so much.
Thank you, Dr. Saavedra, Dr. Prasad, for your presentation and letting us know what Age of India is doing. So before we move on to the questions from the attendees, I'd just like to ask something here to both of you. Like from your presentations, we do understand that you're working on AIDS. So is there anything apart from AIDS, something beyond that, that HF would be having mandates on?
Beyond HIV/AIDS, yes, of course, we are supporting these projects of genomic sequencing, but we are also supporting wellness centers. I don't know, I think Sam mentioned them in different countries. And wellness centers are usually for testing for STIs. It's not for HIV positive people, but the ones at risk for other STIs. And well, there is another area of prevention and advocacy. And of course, the main core of AIDS Healthcare Foundation, of course, is HIV/AIDS. But right now at the University of Miami, what we have been mainly dealing is with public health policies and supporting genomic sequencing for COVID-19.
COVID-19. So would you be considering something beyond COVID-19, other infectious diseases or something like that?
Yeah, well, right now, part of our advocacy has been about infectious diseases. I don't know, Dr. Sam, what else are you providing there in India beyond HIV?
Yeah, so I think, we are looking at HIV as the base to step in, but then, we are definitely covering TB treatment in partnership with the clinics. I mean, the TB program here, the National TB Elimination Program. Also, we are doing a STI screening. Now we have introduced the duo test kits, which actually with one finger prick, we can actually do HIV testing as well as syphilis testing. And let me just tell you, I mean, I might be sounding very, I would say, very harsh here, but then I think India is facing a syphilis tsunami. That's what, what we are seeing from our results. So we need to concentrate on the lesser talked infectious diseases like STI. There is no focus currently or lesser focus right now on STIs. And it's very much highly prevalent among the general community. And the awareness has to be pepped up. I think, those are the areas that we will definitely be looking at. Thank you.
Thank you. So now let me take up the questions from the attendees. So Dr. Rajesh Pandey has asked, was wondering whether AHF would partner with TB Elimination 2025 program in India.
Absolutely, yes. Thank you for that question, Dr. Rajesh Pandey. And definitely we are already doing it in our clinics and in our clients, among our clients. But then we can actually look at what kind of a partnership we can forward. Because without TB testing and TB treatment, HIV testing or treatment is incomplete. And this is the most commonest OI. So we definitely have a scope for partnership there. And let's meet up, or let's go beyond this meeting today, and then let's meet up and discuss what we can do together. Thank you.
Mm-hmm. Thank you. Pradeep Kumar has asked, how can one be a volunteer or member of AHF activities?
Oh, thank you for that volunteership. Thank you. We need volunteers, definitely. India is a big country and we are a small group, but then we definitely work with volunteers like you who are willing to come on board. And first thing is that about our free condom store. We can show the status. I mean, post on social media about us. You can talk about the services, because social media is a big thing in India. And I think, the largest number of smartphone users ever in this world is India right now. And the younger population is using a lot of social media. And I think, we can start like that. Mr. Pradeep, please, be in touch with us, and then let's share our coordinates, and I welcome you to our team. And then, let's start looking at how we can work together. Thank you so much for volunteering.
Thank you, Divya and Joanne, for your compliments for Dr. Prasad and Dr. Saavedra. Of course, both the presentations were really great. And I don't see any further questions. Thank you both for being here and your time and the great presentation. And I'm sure we'll be initiating some further dialogues other than what we're already doing together, and I'll get in touch. Thank you all the attendees for being here. do feel free to contact or drop in a mail if you want to discuss anything further with either of them or with AHF in either research or voluntary or anything. Thank you so much.
Yeah, well, thank you very much for the invitation. It's a great honor for AHF to invite us to these kinds of presentations and to discuss and take questions from students and from the audience. But I also, that's why I insisted to have Dr. Sam here, because we are doing a great job there in India, as well as some other countries, but this time it was for people in India to see what AHF can do in India. And of course, we are very happy with the work of Dr. Sam is doing there.
Thank you so much, Dr. Saavedra. Also, thank you so much, Dr. Aradhana, for facilitating this, and also the participants who are with us today. Please reach out to us. We are in Delhi, we are in Mumbai. Dr. Divya is definitely the team leader in Mumbai. So we are in Lajpat Nagar, nobody misses Lajpat Nagar, Dr. Saavedra, when they come to Delhi, because that is a market, the most popular market in Delhi. So we are housed right in the Lajpat Nagar too. So please reach out and let's all work together towards curbing the HIV epidemic. Thank you so much for the opportunity.
Thank you.
Thank you.